And look at some global news. Dr. Tedros Ghebreyesus will be the only candidate when the World Health Organization votes to elect its Director General next year. He was first elected in 2017 as the first African to lead the global health body, but his first 5-year term expires in August next year. The 56-year-old former health minister from Ethiopia, who has been at the forefront of the global fight against the COVID-19 pandemic, secured the backing of 28 countries who submitted nominations before the September the 23rd deadline. Joining us to discuss is SABC News' international editor, Sophie Mokoena. Sophie, thank you for being with us. This surely is a big nod for the way he's handled COVID-19, even though, of course, along the way, he's actually been very critical of many country members of the WHO.
Yes, indeed, Francis, it is a nod, and clearly many countries are happy in terms of how he has handled this pandemic. You know that it could have been a bit steep for him if the President of the United States of America is still Donald Trump, because you know very well that he took a decision even to pull out of the World Health Organization, and he was going to influence other countries that support the U.S. In terms of ensuring that Tedros is shown the door. But with the new president, President Joe Biden, there is some synergy between President Biden and Dr. Tedros. You know that in terms of how the United States of America has committed itself in terms of assisting the poorer nations and developing nations to have access to vaccines. He has been engaging with Dr. Tedros with the idea that Dr. Tedros, introduced the idea of the COVAX facility. And therefore, I can't see any hurdle. We know that Ethiopia, the Prime Minister of Ethiopia or the government of Ethiopia, will be reluctant to support him because, you know, he comes from that region, Tigray, and Ethiopia has accused him of perhaps siding with the rebels in Ethiopia. But for him, it was always about how ordinary people in Tigray have been affected by that conflict, and the fact that the health organization or agency couldn't be able to really help Tigray during this crisis.
All right, so he's the lone candidate, and you're saying not much could scupper his nomination. Has he said anything about being willing to serve again?
Yes, he has indicated that if he gets nominated, he is going to avail himself for the second term. And I guess today he is celebrating after the Secretariat of the World Health Organization issued a statement that closing date, because of the closing date, now they can't take any nominations, and for now he is the only person. And now what's left is the interviews next year, and of course voting during the Health Assembly next year. And I can't see him not getting this one. Truth be told, there were challenges. There are things that the WHO can have perhaps put its socks then to improve the access to health in terms of this pandemic, but they did try their level best. I think a blight will be the issue of how China conducted itself, particularly during the investigation, when the team was sent to China to investigate the origin of coronavirus. But unfortunately, they couldn't get proper access, and there are questions raised there. But remember, when you talk about United Nations, all the agencies, you work with consensus. You can't just instruct member countries. It is a consensus-based rule. I mean, you have to have a buy-in, and therefore all heads of these agencies, there's nothing that they can do if member countries are not cooperating or supporting what's on the table.
All right, thank you for that update. SABC News' international editor, Sophie Mokoena.